Hello, everyone. It's Friday, August the 7th. Very regretfully, I've got to announce 3 more deaths. Our 125th death is an 81-year-old female in Pleasants County. Our 126th death is a 66-year-old male from Mingo County. Our 127th death is a 73-year-old male from Mingo County. Again, I sound like a broken record, I know. But these people aren't broken records. They're people. They have families, they've got names. Please, absolutely please, don't let them become that statistic that I've talked about before. We've got to stop this killer. And we will stop it. But for these people, it's too late. And for these families, it's too late. Please be with them in prayer. And think about them. Because they're precious. They've been great West Virginians, and we appreciate them. Yesterday in the state, we had 139 positive cases. We're testing a lot of people. We're up to 312,521 people that we've tested so far. We had a daily percentage rate yesterday of positive of 2.66. Our active cases are now at 1,796, which is down from 1,817 on Monday. We have 122 people now that are hospitalized, and that's up from 115 people that are hospitalized on Monday. And it doesn't take a rocket scientist to see that, while we're very, very concerned about these numbers and what's going on within our state, our numbers compared to the entirety of our nation are still phenomenally good. And our effective reproduction rate, that RT or R naught number that Dr. Marsh speaks of all the time, and get this because this is monstrously important right here. We're now at 0.92, which is the 8th best in the nation. So we're moving it, and we're moving it, and we moved it in the right way. Well, how have we done that? Well, the number one way we've done it is wearing our mask. When I made the wearing of the mask mandatory, a lot of people pushed back, and a lot of people didn't like it and everything. Still, there's a lot of people that don't like it. I'm one of them. But it works. And we see it right here. It is working. Now, as I go further, I want to tell you just this. Right behind all that mask wearing, thing that happened from the standpoint of us getting out in front and saying, we want it to be mandatory now. What happened? CDC followed, the president followed, all kinds of people followed and said, wear your mask, make it mandatory. So really at the end of the day, that's what we're doing, and it's getting better from that standpoint. We still hate more than you'll ever know losing great West Virginians. Now, as far as our school reopening plan, I've been working with the Department of Ed for months. Since school was called off earlier this year, the Department of Ed has been in communication constantly with our union leaders and our union teachers and everything. To say that this is anything but a long-term effort, no question, is a real insult. And it's not necessarily just an insult to me. It's an insult to all those people at the Department of Ed that do great work all the time, and especially all the county people, whether it be the school board members or the superintendents in the counties and everything that have been working their tail off on this, on our program that we released for a long time. I want to reemphasize that the safety of our children is the most important and of paramount importance beyond belief. And, from the standpoint of the safety of our teachers and service personnel, same thing, exact same thing. I'm willing to bet that as we go forward, that there won't be a place. There won't be a place versus a Walmart or a grocery store or wherever it may be. There won't be a place that is absolutely more scrutinized and more safe than where our kids and our teachers and our service personnel will be. You know, we've given tremendous flexibility, you know, to our counties and everything for them to know what is the very best for their communities. We have done this with a scientific metric and everything, and we're continuing to work that way to where we'll be able to show you as we go forward, the metric will be completely transparent of how we're going to evaluate each and every county and do it in as fair a way as we possibly can to where we are, you know, part, you know, in school, part virtual or hybrid of that, whatever it may be. But it may very well be that the county reaches a certain level where we've got to go 100% virtual. You know, everybody is pivoting and working on just trying to figure out how to do exactly that. We have, in our plan, we have given great latitude and great choice to our parents. You know, I don't know of anyone that could know the kids better than the kids' parents and what they think is safe and what they think can be done. Now, along the way with this, don't think it just fell out of the sky, you know, that we come up with an idea how to spend $6 million and get this access to all these kids and everything and families. And don't think it just falls out of the sky from the standpoint of our tablets or whatever that we've got to get and everything to be able to make sure that everybody's got one and everything. All of that is a plan. Is it perfect? Well, of course it's not perfect. But is it perfect from the standpoint of the very best of our abilities with all of our experts and everything that we can do today? Yes, it is. And so as we go forward, I welcome your questions from the press and everything, and we'll talk some more about that. You know, from the standpoint of our Kids Connect program, which is the 1,000 points of light, the wireless internet that we're going to have, you know, at all the different points across the state. It'll be in all 55 counties. There'll be all the K through 12 schools will have it, where you can go to the parking lot there and do whatever and get on the internet. And there'll be 32 higher education institutions that will have it, 255 libraries, 31 state parks. So it's a big commitment. It's a big commitment in resources and effort to get it done, but we're going to get it done. And I think today we've got a map. Gosh, it looks like somebody's patterning a shotgun, to tell you the truth. But that's up, and you guys, you know, take advantage, look at it and everything, and it's all up on our website. From the standpoint of our churches in West Virginia, we now have 7 outbreaks reported in churches in 5 counties. That's Cabell, Grant, Logan, Mason, and Taylor counties. These outbreaks are accounting for 89 cases. I can't urge you enough. I can't tell you enough times and everything. Social distance, you know, personal hygiene, wash your hands, absolutely keep a pew in between you and the people in the church. Absolutely, everybody needs to be wearing a mask at church, and I get it. You know, church is the foundation of every last one of us, and the most important, maybe of all, and especially from the standpoint of our elderly community. Now, with all that being said, we can go to church and we can do it, but you've got to be safe and you've got to follow these guidelines. Now, the small business grants, I don't need to get into all the stuff about it. We have now awarded $7.6 million. You know, that's going up as with the counties and the cities, how it took a little while to get really rolling and everything. In excess of 2,000 applicants have sent in and everything. We want to keep pumping that money out just as fast as we possibly can. We have a veterans nursing home that has an individual that has tested positive. She was traveling and she has not been at the facility. She's a staff person and she has not been at the facility since July the 26th. That's really good. Once we were notified, all the people again ran to the fire. I thank the National Guard. I thank the DHHR. Yesterday afternoon, and the facility administrator, they all were working hard with the director of nursing all yesterday afternoon. They've set an action plan in motion, and on Monday we will test all the residents and staff. 2 previous tests have been 100% negative. That's really good, but we've got to really be safe. And I want to again to thank the DHHR and the Guard for all that they're doing and doing, like I said, over and over, run to the fire. That's the very thing that we've got to always do. And I want to especially thank the Department of Veterans Assistance for continuing to protect and serve our veterans. How could there be anybody more important than our veterans? How much have they given and how little do they ask? And so we absolutely want to do everything in our power to make sure that we keep them safe. Across our nation, to be perfectly honest, across our nation, there is veterans nursing home after nursing home that's had catastrophic problems. We haven't. And we try in every way in the world to protect and prevent that from happening right here. And please keep this situation in your thoughts and prayers as well, because, this is right where we could have a problem. And let's just hope and pray we don't. In Wood County, there's a confirmed COVID case. There was a confirmed case earlier this week at the Wood County Courthouse. County officials requested the assistance of our National Guard. They were able to immediately go there and assist with sanitation. We will continue to work with the Wood County Commission to give them any support that they need. And this is yet another example of just what we have done over and over. I can't say it enough. Run to the fire. Our National Guard's done an incredible job. Incredible job. Now, on the clothing allowance, there's school clothing allowance. That came up the other day, and I'm sure that Secretary Krause will talk more about this, but the DHHR will begin accepting school clothing allowance applications on Tuesday, September the 1st, 2020, for eligible children enrolled in the West Virginia schools. And I'll let Secretary Krause talk about this more, but each eligible child will receive a $200 benefit that may be used towards the purchase of appropriate school clothing or piece goods for families who sew their clothing themselves and everything. And so I'll leave the rest of it to Secretary Krause. Our free testing, this week we will be in Raleigh, Hampshire, Jackson, McDowell, and Taylor counties. Next week we'll be in Brooke County. Follow the stuff up on our website and everything. We encourage our minorities to come. The more we have information on our minorities, especially the African American community, the better off we are and everything. All of us have known since the outset of this whole terrible virus thing that the African American community has been disproportionately affected. The more information we have, the better off we'll be. Please come and be tested, but the testing is available to all. So understand it's free testing. It's available to all. Okay, as far as our cities and our counties, on the monies of our CARES Act, now we've got out $72 million to 166 cities and counties. We continue to ask for more and more applications and everything. We'll continue to send the money out as fast as we can get you qualified, and all that's really flowing really well. On our summer feeding map, if you'll look, we've got 696 sites, the same number that we've had. If you're having an issue and everything with where to go or how to get food or whatever like that, please just pick up the phone and call 211. We'll give you assistance and everything, because we don't want a single West Virginian going hungry. Please jump right in and try to help us with that. Our census, like I said, we got to be counted. Now, from what I understand, the date on our census counting now has been moved to, I think, April 30th from October the 30th or 31st. They've moved up the date that will be the deadline of being counted. West Virginia, you're still behind. You're behind. You've got to help me with this. We've got to get counted. Nobody's preaching this any more than me, because I know the amount of federal dollars that flow our way. There's nothing to be afraid of. There's nothing to be afraid of to be counted here. Nobody's going to come and get you for something bad or whatever. Just get counted, West Virginia. I mean, it's really, really, really important. And other than the fact that our daily positive is trending under 3 is really good. If you can look at your graphs and all that, that's good. We're happy about all that. You know, we're seeing a little separation here in our recovered cases. You know, if you'll look up at the top, you'll see that separation is really starting to happen. And that's really good stuff. That's what we want to have happen exactly right there. So we're going to keep hoping and praying that separation between recovered and active cases continues to happen. Our daily positive, you know, is at 2.66, and we want that down even further than that. And if you'll look, you know, our cumulative positive down in the bottom just tilted a little bit down, and that's what we want to have happen there. Got a long ways to go, West Virginia. There's still a lot to be concerned about and everything. And the only other thing I would tell you is just this, and this goes back to our schools and how we reopen and how we do it on a county basis. Now, don't get focused on the red or the green or the yellow, because this does nothing whatsoever to do with the red and the green and the yellow and the orange. You know, so now I'm going to say it one more time. This map does not have anything to do with the color coding to how it's going to be, you know, once we come out with the metric on how to measure that. The only reason that I show you this is just to show you the diversity in the counties and why we have to do this on a local basis versus a statewide basis. And Jordan, if you'll put this up, I'll talk just a second about it. All those counties that are green, you look at that. Those counties, as far as active cases, have 1 and 0 and 0 and 0 and 5 and 4 and everything. How can we not be in school right there? And look down in the bottom. I've told you over and over and over how this movement from the south is what I'm worried about. Now, that doesn't say in any way we're not going to go to school in those southern counties. There's no way, and I've said this 14 times. I hope you're listening. But all I'm showing you is that movement from the south is real. It's as real can be. Up where there's red in those other counties are a big population in most of those counties. But that movement from the south is the real deal, and that's why we got to stop that. Now, but you've got to be able to see the diversity in our counties, and that's why we came up with a plan that's going to give a lot of assistance and a lot of credence to what our local superintendents and our local school boards are telling us it should be done and how we ought to be able to go about educating our kids. But nevertheless, that's all I've got today. Thank you.
All right, thank you, Governor. Let's now go to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. As the governor said, I'll try to provide you more information on the school clothing voucher. I believe David Beard asked that question Friday. We had Wednesday, and we had information coming through on Wednesday to announce this. So good timing. As many families are starting back to school preparations, we're happy to begin accepting school clothing voucher applications on Tuesday, September 1st. For eligible children enrolled in West Virginia schools. The delay provided us the ability to make changes to the system to allow families to shop online from the safety of their homes, which we hope is an advantage for those folks who are trying to isolate and stay safe. The school clothing allowance program recipients will receive either an electronic benefit transfer card or an EBT card or a check in place of the traditional paper vouchers. This system upgrade, again, will allow both online transactions and increased choice of vendors when purchasing school clothing or piece goods. We have on the screen, we have additional information. The following will automatically receive school clothing allowance benefits for each school-aged child in the home by the end of August. Those are families with school-aged children currently receiving West Virginia Works cash assistance, those in foster care, or children aged 4 through 18 that receive SNAP are enrolled in school and under 100% of the federal poverty level. So again, if there are any questions on that, please go to the DHHR website. There will be information there for individuals to access. Any questions with that, please let us know. Let me mention 2 other items real quickly. We have, as the governor asked and talked about last Monday, St. Francis Hospital, part of Thomas Health System, has been readied for patients. We again want to thank Dan Laufer and Thomas Health System for moving so quickly to get that implemented and ready to accept patients. We actually anticipated a transfer yesterday that has not taken place, but there will be transfers in the future. Those will be coordinated with DHHR and with Thomas Health System. So one other item, briefly, I've spoken many times about the dashboard and online. We try very hard to be transparent and provide all of the information we can provide, and we're looking to provide more in the future here, the immediate future, as soon as we work through some changes and get everyone's approval. But there were some corrections. One correction of individuals from Pendleton County to Grant County. And just so everyone is aware of exactly what the reason for those changes were, through the investigation of individuals who became positive, it was learned that previous negative results from patients did not include an address. So once those investigations of the positive cases were done, the addresses of those individuals were changed. So there was a relocation or movement of those cases from one county to the other. Again, as we work through investigations and we do contact tracing and we learn more information, some of the data can change some. This is the benefit of having good contact tracing and making sure that we know where these cases reside. When they're in nursing homes, that becomes a little more difficult from the standpoint of their home address prior to being placed in a nursing home. So this was not a case of anything other than locating better address information for those individuals. And as I've mentioned before, investigations are not done on negative cases. They're only done on positive cases. So that's why we just now, as those individuals turn positive, move those cases. So thank you. That's all I have. Thank you.
Thank you, Secretary. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. As the governor pointed out, we have seen a substantial improvement in our RT values, that reproductive score, since the governor issued the mask executive order. So well done, West Virginia. We also know that there is a predictable lag between the time that we see that RT score get better, which, remember, about 2 weeks ago, we were the worst in the country. We had the fastest rate of spread of COVID-19 of any state. Now we have done much better thanks to your great work and the governor's leadership. But remember, it's about a 2-week lag before we start to predictably see a reduction in cases, and about a 3-week lag, or maybe even 4 weeks before we start to improve some of the severity of the illnesses. As the governor said, we have more people that have been admitted to our hospitals today than we have at any other time during the pandemic. So as we start to activate our communities, we start to open our schools, then we know that's going to put additional pressure and stress on our state, on our local health departments, because of the complexity of all of those moves. So I think it's really important for us to be very cognizant that despite our numbers looking better, in some ways, we still have a higher number of cases than we've really experienced on an average, before. And because of that, we have to be really, really highly committed to wearing our mask and physically distancing. Both are important. We know now it's not just the droplets that go way out that cause the disease to be spread, but it's also the aerosol that is closer to your mouth. The other thing I would like to say is the governor has mentioned the outbreak areas, and certainly we know that churches are a vulnerable place. I think one thing that's really important for the parishioners and for the clergy oversight to know is that singing or chanting also increases those droplets and aerosols. So certainly that's something to think about as we're in church and as we're together, is to potentially, if we're having problems or if we can't distance sufficiently, to also think about that, because that has been documented to be a mechanism of spread. So thank you very much.
All right, thank you, Dr. Marsh. Clayton Birch, our State Superintendent of Schools, and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. Major General Hoyer is attending the funeral for the Guardsman that passed away last week, and he will join us again on Monday. We'll now go to questions from members of the media. Today's first question is from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. President Trump said some things this week. When he called into Fox and Friends, he said, if you look at children, children are almost, and I would say definitely, but almost immune from this disease. Then he added, they don't have a problem, they just don't have a problem. The president continued regarding the opening of schools. My view is the schools should open. This thing is going away. It will go away just like things go away, and my view is that schools should be open. So my question for you is your view. Are children immune, and does the virus go away? Thank you.
Brad, first and foremost, I don't write the scripts for our president, and he says what he thinks are his ideas and on his mind. From my standpoint, I would say that children surely have shown that they have more resistance to this. But as far as being children immune, I don't think that. I think absolutely our children can contact or this disease can affect our children as well. But we all know that from a standpoint of the number of children that are running around and are being with parents or being with friends or being with everybody, the numbers that we show that children have problems are very, very, very small. From the standpoint of this thing just going away, I think absolutely that this thing will go away, but I do not think it's just going to go away. I think it's going to go away because our scientists and our medical community have got to find, vaccines or drugs that greatly minimize the situation and everything as we go forward. But to say that all kids are immune, I would never say that. To say that all kids have a great deal more evidently resistance to this, and the outbreak of children having this is very, very minuscule compared to our elderly community. This thing always, I've said over and over, targets our old. That's all there is to it. It just targets our old. But children surely can get this. We know babies that have gotten this and everything. So from that standpoint, that's exactly where my thoughts are. And from the standpoint of will it just go away, I don't think it'll just go away. I absolutely believe that what we're dealing with here is a real live pandemic that is absolutely going to have to stay with us until we are able to get a vaccine, get drugs that'll make it go away. And the other thing we're going to have to do in the meantime is we're either going to have to just ball up in a corner, or we're going to have to learn how to live and deal with the risk as best we possibly can.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, Governor. This is Kenny Bass with Channel 8 and Fox 11. You've said that you wanted to keep the pandemic and COVID-19 as non-political as possible. When you've been criticized by Senator Manchin or by Commissioner Salango, you've accused them of playing politics and said that's inappropriate. An ad that was put out by your campaign this week references a budget cut that the Kanawha County Commission imposed upon the Kanawha Charleston Health Department in 2019, and then mentions the number of COVID cases in Kanawha County, and then mentions that Commissioner Salango may be responsible for the number of cases. So I'd really like to hear your thoughts on the politicizing the COVID-19 pandemic from your campaign standpoint, when you yourself have said many, many times it's inappropriate that this would be in a political arena. Thank you.
Okay, Kenny, from my standpoint, here's exactly what I'd tell you. First and foremost, I've said it over and over, everybody, that I don't deal with my campaign. I don't go. I've never been to our campaign headquarters. I'm trying to deal with the pandemic from the standpoint of how we're dealing with everything that's going on every day. From the standpoint of that ad, I think that the primary emphasis to the ad is just one thing, and that is this: my opponent is young and tremendously inexperienced, and handling this kind of level of issues, it takes somebody that's been there, done that. I mean, for crying out loud, I think that's the whole emphasis of the ad, but nevertheless, that's a campaign ad. It's a paid-for campaign ad. I don't do that. I mean, this is not the forum to be discussing that. This is the forum to be discussing exactly what I discuss here every day.
All right, next we'll go to Claudia Sessa with WVNS.
Good afternoon, Governor Justice. Claudia Sessa, WVNS 59 News. We were contacted by the wife of an inmate at Southern Regional Jail who said there were issues with overcrowding and personnel not wearing masks. We also know there's an inmate who tested positive who is set to be released. How do you respond to these concerns?
Okay, Secretary Crouch, I need you to help me a little bit right here. If you could jump in, can you help me a little bit with this, sir?
Sir, Governor, we do have one inmate that tested positive at Southern Regional Jail in Kanawha County. 34 others were exposed. These individuals are being isolated from others to the extent possible, and we are testing individuals today, the other individuals today, to try to ascertain whether we need to do more. So everything is being done according to the process, and the epidemiologists are looking at this. So that's really all I can respond to with regard to the question.
All right, thank you, Claudia. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Governor, I want to talk. I know the news conference yesterday, they said that there were some communication issues with the governor's office when it came between the unions and their concerns. So I guess this question is for you and Superintendent Birch. Do you feel that the communication between everyone, as far as the unions are concerned, has been adequate?
Oh, man. I wish, Amanda, we hadn't asked this question, but, from a standpoint of just, in trying with all in us to keep as much the political out of this as we possibly can, but anybody and everybody knows that was just a political stunt yesterday, and I can say this, and I say this with a very clear conscience. From the day that I walked in the door, as far as my support for our teachers and our service personnel, it's been as real could be. I said education should be our centerpiece. There's been so many things we've done in regard to the education arena, and we've been as helpful as I know we can possibly be. And I would put my record as far as helping our teachers and our service personnel up against the past predecessors, and it would be overwhelmingly, that where I have stood rock solid with helping them, and that's what I'm going to continue to do. We got to stop this. I mean, I know it's a political season and everything, but for crying out loud, it disappoints me tremendously to have had, the likes of Fred or Christina Christina or Bobby or Dale or David, all that we've set hours upon hours upon hours, and I've done every single thing under the sun to try to help. And then we turn right back to the same old nasty politics. Well, you know, we're going to just go straight with the Democrats. We're going to go straight with the Washington liberals. We're going to stand with the Washington liberals trying to hit at our president, and that's all they're doing, and that's what we're going to do. Now, does that make one thread of sense? Well, it doesn't. And it hurts your feelings and all, because I have stood strongly in the camp, and I have absolutely, and I'm going to continue to do so because I believe in our teachers, and I absolutely believe in the great work that our service personnel does. And from the standpoint of them being involved, you know, it is preposterous. It is totally preposterous to think that they have not been communicated with in every way. This is nothing but nasty, nasty politics. And Clayton, if you jump in, please, and follow up on this, because without any question, they've been in the loop all the way. Clayton, go.
Thank you, Governor. And Amanda, I think I'll bring it back to the crux of your question, which is communication. I will try to stay as distant from the items from yesterday that I can, but I can tell you that you know, it is a shame because our counties are doing a great job. I remind everyone that I am a parent, so I get to see what happens out of here and how that translates down to the community. You know, there's a part of me that wants to reach out, and I want to thank Dale, and I want to thank Fred, and I want to thank Joe, because from day one, they've been with us. They have brought every single item of concern from teachers and service personnel and the parents and community to us as we built these guidance documents. I've made myself available as often as I can. I've never turned down any opportunity to talk to groups and whoever they may be, you know, and I just, you know, even yesterday, as a matter of fact, when it comes to communication, our board president, Miller Hall, says it best: communicate. There's never enough we can't communicate. So, you know, as a matter of fact, yesterday, the School Board Association, which is made up of our locally elected school board members, what a great meeting that was. They completely understood where we are. We continue to talk about the concerns, and we just continue to focus on safety. This map and metric that the governor and Secretary Crouch and Dr. Marsh are working on, it's another tool that's going to make sure that these local superintendents can make the best decisions they can. But I cannot, you know, stress enough that from March 13th, I can't find a group that has not had a voice in helping us put this together.
All right, thank you, Amanda. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hey everyone, it's Taylor with the Herald-Dispatch. This is for the medical professionals. I saw this on a Facebook thread, and I thought it was a really good question. What's the importance of making sure that you sanitize and clean your cloth masks? Could you get sick if you don't make sure that you're taking care of that?
Okay, Dr. Marsh or Dr. Amjad, this is you guys, not me.
Maybe I'll start, and then you can add in if that's okay. So that is a really good question. And what the recommendation is that every day after you finish wearing your cloth mask, you will wash it in soap and water and either air dry it or dry it on higher heat in the dryer. And the reason why you want to do that is, as you suggest, Taylor, that you want to make sure that the outside of the mask that might come into contact with other people is clean every day. And also you want to make sure that you don't have the opportunity to track anything that would be on the outside of the mask back to your face or your nose, your mouth, your eyes. So when you put your mask on and off, if you have to take it off during the day for any reason, you really want to use those ear loops to take them on and off. You never want to touch the front of the mask once you've been around other people. And if you need to put it back on with the ear loops. And then at the end of the day, washing it on a daily basis is what's recommended.
No, I don't have anything to add, but Taylor, that's pretty much why, just like your clothes, you change them every day and clean them, but everything Clay said is accurate there, but nothing more to add. Thank you.
All right, thank you, Taylor. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, on Wednesday, based on comments from the press conference from yourself and Superintendent Birch, I was under the impression that teachers and service personnel would have the same option to opt out of in-person school this year as parents do, and a rep for the Department of Education later told me that wasn't the case. I was hoping you guys could just clarify that, please. Thank you.
Charles, I may have slightly misspoke there, I guess, you know, in the press conference on Wednesday and everything. But what I really meant, what I was really saying was just this, is if someone has a medical reason that would put them at real danger and everything, you know, we absolutely we'll work in every case with everyone as best we possibly can. Clayton will have to follow up and answer this better than I, but I just want our teachers and service personnel to know just this. You know, this disease is everywhere. It's right here, right now, and it's everywhere. I can assure you beyond a doubt that every single safety precaution known to man will be taking place in our schools to ensure the safety of our children. For crying out loud, our children. I mean, if you'll just think about it, our children first and foremost, but you just as well from the standpoint of our teachers, our service personnel, the administration, all of you. We need absolutely for it to be flawless, the very, very best that it can possibly be. As far as working with others, surely we'll work with others and everything. If you want the real truth from my standpoint, I would tell you the Washington, Pelosi liberals that run through the streets in D.C., do you really think that these people care about our kids in West Virginia? Do you really think they care about our teachers? Do you think they care? I mean, really, what they care about is one thing, and they care about hitting our president and trying to win an election. Now, at the end of the day, I'll promise you there won't be a place on this planet any safer to be or any more cleanly than our schools. Now, Clayton, if you could answer that about the you know, people that have medical issues or whatever, but we've got to have our people report to work.
Thank you, Governor. You're absolutely right. We absolutely need everyone to report to work, and we continue to stress it's all hands on deck. However, you know, the point has been made very clear that I meet with the superintendents, the local superintendents, each and every week. We have a standing weekly meeting, and we continue to talk about taking care of not only our children, but our teachers, our service personnel, and our professional educators. I have been very, very vocal in being as flexible as possible to all those who have a medical condition, health concerns. We have put out a lot of guidance. We're asking our superintendents and our principals to work with each and every one of those individuals that have any concerns and medical conditions. We all have a role to contribute to our children, and we want to make sure, and I promised I would not use her name, but we have a teacher that is a wonderful, wonderful teacher and dear friend of mine in Cabell County, and you know, she does and is struggling with a health concern. But she wants to contribute. She wants to be that one caring adult, and we're going to find a way for her to continue to be engaged, and we cannot lose that kind of effect we have on our children.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members and Superintendent Birch. I direct this question at the Governor and Superintendent Birch. I hate to keep circling back to yesterday's news conference, but this was an issue that came up, not necessarily a political issue, but a policy one. There were some concerns expressed there, apparently, that the guideline of keeping the desks for children 6 feet apart might be modified and that the state might be considering moving the desks 3 feet apart in the classroom. True or not true? And what is your guidance, Curtin's guidance for seating kids in a classroom, and why do you take that reason?
Mark, I don't think there's any truth to that whatsoever, but I'll pass to Clayton, and Clayton, you know, you can maybe talk more about it. But But you led off by saying, Mark, that it was political events yesterday, and gosh knows you're right there, brother.
So, yeah, I'd be glad to take that, and I will welcome if Clay Marsh or Dr. Amjad wants to jump in. They have been with us from day one trying to put the guidance out. So it gets really difficult. I know there's this focus on 3 versus 6 foot, or what's the classrooms look like. And I want to just, make sure that all of our families understand that the classrooms will look different. My own guidance document for my children I reviewed. I was very, very pleased to see they took into consideration our youngest learners. We know that they learn different. We know that they interact different. Our teachers, when they teach pre-K and kindergarten and first grade, are going to have to balance this of sharing materials and how to keep socially distanced. And I don't think that'll come down to a exact 6 foot barrier oftentimes. But as we move up into the ages, we know that our 6th through 12th grade students are able to stay further apart. We know that the footprint inside the building is already getting smaller. Raleigh County alone had 2,400 students sign up for virtual school. That's 2,400 students that are not going to be in the building. So those socially distanced classrooms are taking care of themselves. And I want to bring up one more classroom that we have considered that has been left out of the discussion, and that is our career technical education centers. Each one of those career technical education centers are hands-on. They deal with a lot of hands-on with specific equipment, and they're even putting protocols in place to make it safe for students to be there to do those hands-on in close quarters. So Dr. Marsh, I don't know if there's anything to add about our young children, but
Sure, I'm happy to add. Governor, it's good for me to go?
Sure, go.
Okay, sounds good. So I think that when you look at the data, particularly from Asia, it's a meter is the minimum distance, which is 3.2 feet. And for every 3.2 feet in addition that you are separated, you gain a 2.2 times benefit in not getting the virus spread. So we use 6 feet, and 6 feet is a safe distance. 3.2 feet, though, is, at least in the published literature, is the distance that folks in Asia use. But I think Superintendent Birch is correct. So the governor was asked earlier about the young children, and there's data from South Korea that 0 to 9-year-olds or 0 to 10-year-olds are less able to catch the virus and less able to spread the virus. There is some data that they might contain more virus, but it doesn't look like that they're spreading it as easily. As kids get older, that becomes much more of a problem. And there's a report out of Israel in the New York Times that talked about a super spreading event in a middle school, high school assembly. So we know that as children get older, then we would need to do different things to try to protect and mitigate the classroom and making it safe. But ultimately, the more distance that we have and the more we can have both our students and our teachers and our staff wear masks around each other, the safer the environment is, we believe.
All right, thank you, Mark. Next, we'll go to Paul Mullin with WCBC.
Good afternoon, Governor. Good afternoon, everyone. This is a question that some parents have put forth to me, and I'll pass it along to you. If you have a child test positive in a school, how does it go from there? Do you wait till the end of the day and send the kids home? Do you send that kid home right away? Do you isolate the kid? How does the contact tracing work? Can you give us an idea on that? And Governor, that may be more for the panel than for you.
No, it's definitely more for the panel, and whomever would like to just speak up. Maybe Clayton, you start, or maybe I just any of you can talk about this.
I will only mention briefly, and I'll turn it over to our health experts, that they have absolutely, all 3 of them that are on the panel today have been so helpful in not only our guidelines we're putting together, the science behind it. So we are leaning on poor Dr. Amjad. She joined the team, and I think this might have been one of the first questions I posed to her was please help us. We need to make sure we have a consistent way of tackling this protocol of a suspected or diagnosed case. So I don't know which one of the three want to jump in first, but this is definitely for them.
Paul, I'll go first. So if a child is in the classroom and they're diagnosed with COVID, of course, we want to make sure all the children have their masks on and are safe. The parent will be notified right away. The local health department will be notified. And the idea is if the child is in the classroom, we want to take the child out of the classroom. If it's in the middle of the day, we would have the teacher or the principal take the child out of the classroom right away to the parent. We do not want the parent to come into the classroom. But first and foremost, we want all the children to be safe, have their masks on, the teacher. And then as far as contact tracing, the local health department would take part of that. The children in the classroom will be taken care of, the teacher, the personnel. Contact tracing would take part right away, but we would not wait till the end of the day to answer your question. That would be taken care of right away, and proper methods through the CDC, through the local health department would be addressed right away. And I'll see if Clay has anything to add to that. But
no, I think that the only issue that we've talked about before is this principle of cohorting and making sure that you're keeping people in the same place. So for instance, having assigned seats so that you know where everybody's sitting and putting people at, consistent locations, or if children are younger, trying to have little pods of children who are together and stay together and don't intermix is really important from this particular challenge, which is if a child is found to be COVID positive, how do you then start to deal with the rest of the classroom, the rest of the school? And the more segregated you can make the classroom and the pods of children that are together or where children sit, then you have a much easier time in trying to identify who is 6 feet or less away from that child, masks and et cetera, as Dr. Amjad said. But I think that what we will see, whether it's in the K through 12 or higher ed, is that there will be a logistic challenge that we will deal with, which is how to identify and then quarantine the children or the people that have been exposed, and then test those folks so then we can know who actually has been infected and who hasn't. But remember, lastly, that, and this is data from China as I remember it. So if you look at household spread of COVID-19 from an infected family member, the data, as I remember, says it's about a 14.3% likelihood that an infected family member will infect other family members. And if you look at an address, it's about 17%. So it's a relatively lower rate of transmission than you might think, and masks make it even better, which is the reason why we're really advocating wearing masks and doing appropriate physical distancing. But we will be very conservative in making sure that we are protecting the folks in the classroom and identifying aggressively, running to the fire, as the governor said, the children that might be exposed or teachers or anybody else, because we want to make sure that we are offering safety to everybody involved.
All right, thank you, Paul. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, this is Emily Allen with West Virginia Public Broadcasting. My question would be for the medical part of the panel. I know there are outbreaks all over the state still, but in southern West Virginia, why do we think, what do you think is the reason or what's happening behind those outbreaks? And do we know how that reproductive rate or the R0 score differs in the southern part of the state compared to the rest of the state, or if there are any specific problem areas still?
Let me lead off, and if we would just listen a whole bunch, there's one place that we can absolutely identify that is causing a real live problem in southern West Virginia that southern West Virginians love beyond belief. I'm probably one of them in the past, but think about it. It's Myrtle Beach. That's where a lot of the problem has come from and everything. But as that migrates, it's also coming from the standpoint that the states, the southern states, have had an outbreak beyond belief, and it is migrating our way. But anyway, if one of our other panel could jump in, I have told you over and over that Myrtle Beach is an issue. It's a problem. It started off when we started making announcements, I guess, weeks ago about Preston County. I think it was Preston County where we had the problems in the beginning.
Governor, this is Bill Crouch. Let me jump in for a second. I actually happened to be in Mingo County and Logan County yesterday. And I told Clay and some others, I had my eyes opened a little bit in terms of these outbreaks. I want to give Logan County Health Department and the folks down there huge kudos for what they're doing in terms of contact tracing and finding out where these cases come from. They actually have whiteboards all around the room with names of individuals who are positive and the contacts of those individuals and the status of those individuals. It is very impressive. In talking to them and other folks down there, these cases are coming exactly where you're saying, Governor. These cases are coming from West Virginians who are traveling out of West Virginia and who are going to Myrtle Beach and other areas, but it seems primarily Myrtle Beach, and bringing the disease back with them. So we are seeing a huge outbreak in southern West Virginia that is of our own doing. It is of our own doing. Changing behavior is so difficult, but individuals who, all of us who go out of state, who go out of our homes, need to wear masks to protect ourselves and our families. Another thing that was just truly eye-opening on this information or on these boards is how many family members of the same family are infected. Clay talked about that percentage being relatively low, 14% to 14.2%. It's still higher than other individuals because there's contact daily, and I'm sure depending upon the number of people in the home and the type of contact, that number can go higher. Clearly, the family outbreaks in Logan County are high. There are a lot of families with multiple members of the family who are positive. So again, the governor is absolutely on point here that individuals who go out of state and who go to Myrtle Beach need to protect themselves while they're there. They need to protect themselves and their families when they come back to West Virginia. I'm sure if anybody else wants to add to that.
And if I can just add one more thing, Bill, because I think that's really important. So we also know that there are a few people that can spread to many others that we have sort of termed super spreaders. And we don't know who those people are. So in these kind of situations, those people might spread at a much higher rate. So that's also the reason why if people do visit places that have high amounts of virus, that they very well might decide themselves to quarantine themselves when they get back and get tested to make sure they're not one of the people who could be infected and infect other people. The other thing is from the RT values, the reproductive scores, Logan and McDowell have a reproductive score that is higher than the rest of the state, and at a slightly lower level, but still higher than the rest of the state, are Mercer and Mingo today.
I will add one more thing if I could, Clay and Governor. One of the things I assumed was happening in southern West Virginia was that tourists were bringing the disease to West Virginia as a part of traveling the Hatfield-McCoy Trail and visiting southern West Virginia. They have not found one case where that has happened. So the tourism is not the problem. People coming into West Virginia many times from rural areas because they ride four-wheelers and they love West Virginia and the opportunities here to do that. They're not bringing the disease to us. This is West Virginians who are bringing it back. So thank you.
All right, thank you, Emily. Next, we'll go to Ryan Quinn with the Charleston Gazette-Mail.
Hey, Governor. Are you going to mandate private schools follow any of these precautions you're praising public schools for? And the other things related to busing. For online-only kids, can you guarantee that they will get meals dropped off at their bus stops or delivered to their homes or somewhere close instead of just available for pickup at certain sites? For instance, Kanawha is planning to only offer pickup for these kids and only at 4 to 5 sites. Can you guarantee these online only kids will also have transportation to the extracurriculars they still want to attend? Can you guarantee all the buses needed for this plus the in-person kids won't be so full they're unsafe? And how are you going to fund enough buses and bus drivers for this? And why aren't you using CARES Act money for that 1.25 billion sitting there?
Okay, Ryan, you got a lot of questions, and there's going to have to be some contribution here from Clayton in regard to this. But from the standpoint of the private schools and so on like that, I know we're still working on that, and I don't know that we've got all the details ready for that. As far as feeding our kids, I will promise you beyond belief that we'll get our kids fed. And from the standpoint of us just saying, oh, well, gosh, we don't have enough bus drivers, or we don't have enough buses, or whatever it may be, you know, we've got to improvise. We've got to figure it out and everything. And absolutely, what we're going to do is we're going to get our kids fed, and we're going to get our kids fed to where they can get the food. And we're absolutely going to transport our kids around, whether it be extracurricular or whatever it may be, and we're going to get it done. Now, that's the only way to go at this. If you go at this any other way, and you go at this, you know, what you get into, Ryan, is just this. You get into Clark Griswold working his tail off out there in the cold trying to get his lights going, and finally you get the lights going, and his dad turns to him and says, Clark, on the third line, you know, those aren't twinkling, or something like that. Well, for crying out loud, what we're trying to do in this whole thing is we're trying to take care of our kids, educate our kids. We're trying to get all the lights on. We're absolutely trying with all in us, with all the resources we have, and pouring more and more resources into it to make it all a reality and everything. And we have the dollars to be able to do it, and we're going to absolutely expect great success out of our counties and everything. And that's why we're doing it on a local basis, to where our leaders from the counties can really lead us and go forward. But Clayton, you can jump in, and you know, it is a monumental task and an effort that our Department of Ed people are doing. They're doing phenomenal work, and we expect the same great work out of our teachers and service personnel. And you know what? They're going to deliver. I know they're going to deliver. I'm with them all the time, and I know just how good they are and everything. But sure, there's a line that's twinkling that we're going to have to do something about. But we got to get the lights on first and foremost.
Okay, well, Governor, thank you. And Ryan, to a few of your questions, I'll break them down as best I can. Since Wednesday's press conference, first and foremost, I have already reached out. We have a process in place to assist our private schools. We've been in contact with them. We already knew the full list of who needed what. So that process has actually already started. Secondly, as to you know, the issues you're stating about, you know, a guarantee of feeding or transportation. You know, I met immediately after Wednesday's press conference. We had a meeting with all 55 superintendents. They understand the challenge, and I think it comes back to what the governor stated. The goal is to take care of each one of these children. So I have to believe that every one of those 55 county superintendents, they're going to work to make sure that nobody goes hungry. They're going to make sure everybody gets fed. We have superintendents that are actually beginning to work with families to find out who needs that assistance. And back, you know, finally to money, I have watched a little bit of the criticism of CARES funding not being available for the education system. That is absolutely false and not true. We are pushing right around $200 million of investment of CARES funding into the education system. And just today, I have a group that's working on additional funds to fill any gaps that a county feels it has on social, emotional, mental health, on anything additional with technology, which includes devices, laptops, access, on top of the 1,000 points that the governor has mentioned, and then also achievement. So between USDA feeding children, CARES dollars, and any additional dollars we've had to request, we are now up over $200 million invested, and we will continue to ask for anything we feel we need to ask for to fill those gaps.
All right, thank you, Ryan. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. With the rise in cases among staff members at Southern Regional Jail this week, has any consideration been given to testing inmates before they go to court hearings or back out into the community?
Okay, Secretary Crouch, you're going to have to do this one.
Yes, sir, Governor. I'll have to get you an answer on that. We have had discussions on that in the past with regard to any transfers of inmates leaving the facility or being transferred to another facility or being discharged into the community. That's a little different question than we've discussed. So let me get an answer for you and we'll get back to you on that.
All right, thank you, Annie. Next, we'll go to David Beard with the Dominion Post.
Hi, this is a what if question, and I hope it's not too political, more practical. But if you get continued pushback from teachers about coming to the buildings, and you get a lot that don't want to come, can the counties overrule that and require them to come back to work? Or are they developing plans if they get a large number of teachers who won't come to the buildings? Thanks.
David, let me lead off, and then I'm going to have to defer to Clayton. So, Clayton, you're going to have to answer this more than anything. But let me just say that I've said over and over and over, you know, not to make any smallness out of any question, and especially yours here, David, because it's not. I'm not referring to that at all. We've got to realize that we're in a pandemic and we got to get the big stuff right. Now, we're going to drop the ball here and there. We got to get the big stuff right. And what's the big stuff? The big stuff is protect our kids, protect our teachers, protect our service personnel. The big stuff is to assure that we're okay through this. You know, and then how we do it, whether it's virtual or it's a hybrid or it's in school, and there's going to be so many different so many changes from whether we're 6 feet apart or 9 feet apart or 14 feet apart and everything. And the reason they're going to change is because we're going to be doing all the three, virtual, hybrid, and in school. Now, and as we do all of that, there's going to be less of a stress put on the building. And so, absolutely, we believe the buildings are going to be absolutely safe. We believe that we can take care of our children and our teachers and our service personnel and be safe. I hope and pray to goodness that we all realize that when we were going through the worst of times, in the very, very beginning, let's just think just 1 second about this as we step back. What about the grocery worker that was in the grocery store and he was checking you, he or she was checking you out and you know, or stocking shelves, and the grocery store was full of people. And yet they came, didn't they? And our people are good people. Good people. Our teachers and service personnel are absolutely the best, and I want to stand with them, and I want them absolutely to know that we're going to make things safe. Now, you know, if we get in a situation where people don't want to come to work and everything, you know, we'll address all that. And we'll address it in a way that is absolutely proper. But I really hope and pray that our people are going to absolutely respond and step up for the love of these kids and the love of themselves and their families. And we're going to be safe and we're going to move forward. And I hope and pray we aren't going to have these situations in West Virginia. But Clayton, if you could take over from there and answer that, please.
Sure, absolutely, Governor. So I think first and foremost, what we've talked about here today is creating a process to where we want to ensure it is safe. We've talked about those that have health conditions having to be flexible. We've talked about the footprint in the building being lower, the stress in the building being lower. We've talked about keeping children in their congregate kind of core groups if we can, especially our young learners. We talked about the number of options we have that's actually going to end up providing options for our teachers. But I have had folks ask me the same question about what if, and I know that's a doomsday what if, but I've not ever felt that what if is actually anything serious, and here's why. I am not one that subscribes to social media. I don't think you'll ever find me on social media. I don't really buy into the extremes. Instead, I like talking to people. And the groups of teachers I've spoke to, both of our two major unions in the state, doing town halls, talking to teachers in the local districts, talking to teachers right here in Kanawha County, including we talked as a group not long ago about a principal here in Kanawha County, and what I'm hearing is exactly that. They want to get back to work. They want to take care of their children. Of course, they want to make sure that it's safe, and I think that, again, these processes we're putting in place for coming back and the re-entry and the target for September 8th, and you layer that with an alert system that DHHR and Dr. Marsh are putting together for knowing what the community looks like, that it's safe for all. It's just layer after layer after layer of us being overly cautious before we do pull this trigger. But again, the majority of teachers I'm talking to are absolutely anxious to get back and support our children. So if there is a situation that happens, I agree with the governor, we will deal with it, but I would be quite surprised. Our educators are just way too dedicated to our children.
All right, thank you, David. Our last question today is from Sean Stinson with the Pendleton Times.
Yes, Sean Stinson with the Pendleton Times. This question is for you, Governor Justice, as well as Secretary Crouch. I wanted to double back to your comments earlier, Secretary Crouch, about the incorrect numbers for Grant and Pendleton County that were finally corrected this morning. Actually, the incorrect numbers in Pendleton County started back on July 29th when there were 6 cases reported on the dashboard that actually were not our cases in Pendleton County, according to our health department officials. They attempted to get this information corrected, and then yesterday, the dashboard popped up another 16 cases that ultimately were assigned to Grant County. So to both of you, I was curious, how are we going to move forward and not have incorrect information on the dashboard when you look at a place like Pendleton County, where all of a sudden 16 cases have caused some panic and some concern with the citizens here? Thank you.
Is it Sean? Is that correct? Okay. Let me start by just saying this, Sean. From my standpoint, and I'm not shirking any of my responsibilities here, but from my standpoint, I will promise you, exactly how I heard of this situation was it came to me from a text from Lisa Amorosa. And as soon, the very second that I heard about it, I went right into action and everything and told our people, you called our people and said, go do this, and everything. And Bill can better describe all the stuff that's gone on there. I don't know all the intricacies of every little thing that's happened there, but from the standpoint of Shirley running to that fire and doing exactly the right stuff and everything, I've tried to do exactly that. But Bill, if you could jump in there, please.
Yes, sir, Governor. And the governor did direct us to dig into that as quickly as possible. The issue actually, Sean, went back to April. There were testing, and this was part of the governor's mandate, his order on April 17th, that we test every nursing home patient and every employee. During that period, as you recall, I believe we tested 22,000 individuals. And as I stated earlier, negative cases are not investigated just simply because of time at this point. Those aren't the cases we're worried about in terms of community spread, and they're not the cases we worry about in terms of making sure that other individuals are isolated or self-quarantined. So there were actually records in April that on negative patients, some of the same patients that just tested positive that had an incorrect address or had no address. And we still have problems with information we get through drive-through lanes and through other testing vehicles out there that has incorrect information. We have unknown on a lot of our reports because some individuals do not want to provide us information, even addresses. We may just get a cell phone number to contact someone. So we're always going to have situations where these data are not totally in line, but we work to correct those as those imperfections in the data or inaccuracies in the data are pointed out to us. So the ones you're referring to, there were actually a couple of situations there where we had information that was incorrect or not on the patient's record. And as those patients became positive, then the local health departments investigated those cases and we corrected the information in terms of address to the correct county. So we ended up moving 18 patients, as I recall, from Pendleton County to Grant County. So again, we try to be totally transparent with this. We're trying to keep the data up to as current as possible and as accurate as possible. But that's what the investigations are for, and that's what the epidemiologists and the county folks do, is really during the investigation, make sure that information is correct and accurate. And we have similar information or similar problems with information from out-of-state individuals who may work in West Virginia. So it's a difficult process. It's a complex process, but we're going to be as transparent as we can and make the corrections as soon as we're aware of those.
All right, thank you, Sean. Governor, back to you.
Okay, everyone. I'd summarize today, or lots of days, maybe in this way. And again, I think it's really important that everyone listen closely. Along the way here in this so-called pandemic that is absolutely devastating and killing people across our nation like you can't imagine, there has never been that playbook, has there? And along the way, we right off the get-go closed schools and nursing homes and visitation in nursing homes and tested everyone and did assisted living and all this kind of different stuff that we just jumped right into, and we really were ahead of the game. And in doing so, we've managed to keep West Virginia's numbers and keep them pretty dadgum good. Now, along the way also, we had delays in things like, maybe we didn't get to Jackson County as quickly as we should have gotten to Jackson County, or maybe a number was wrong here and there and everything, and maybe then we had to make adjustments. And now we're in a situation to where nobody back in March would have ever dreamt that we could possibly be in a situation questioning whether or not we should be going back to school. Just think of the at-risk kids that in March, now we're looking at heading into September, and maybe nobody has laid eyes on them for a long time. Maybe they're kids that are having real troubles at home, or real troubles that we can be helping those kids. Maybe they're kids that didn't have any way of reaching out to any kind of internet, and absolutely, we're losing them as far as their education. Maybe we're losing kids that just decide to just give up, and they're not going to come back to school. There are so many responsibilities here. Without any question whatsoever, it's not going to be perfect. It's not going to be that. I hate like crazy sitting here going through and defending people's choices of what they're doing. We're surrounded by the very best experts that we can possibly have. And from the standpoint of West Virginia, you, West Virginians, have absolutely made the miracle come true. You have knocked it out of the park. And how you've knocked it out of the park is you listened. You absolutely followed the guidelines that we put out, and you knocked it out of the park. You became the miracle that everybody said was totally impossible, and you became the miracle in doing it. Now, what we got to do, West Virginia, for our children, for our teachers, for our service personnel, for the economies of this state, you just think about just this. What if from the standpoint of our economies, we had pushed all the wrong buttons and now we were hemorrhaging for cash in every way, So many of these programs, so many of these things that we're able to do, we couldn't even consider. We pushed the right buttons there. There's two phases to this. There's a medical side that protects us. That's first and foremost. But right behind that, there's the economic side and the economic impact of keeping us viable and moving and absolutely taking care of our people and making sure that they're okay, they can pay their rent, and pleading with landlords to not evict people. This is a great, great, great big monumental task. We will not be perfect in what we do. Only God above can pull that off. We will not be anything close to perfect in what we do. But absolutely, we're surrounded by the best experts that are going to do the very best jobs that they possibly can, and they're going to do that to protect us all. Kids, teachers, service personnel, all of us. And I thank everybody that is behind this effort, and we're going to get it done. And this day will pass at some point in time, and I think it will pass with that vaccine or that drug that makes it go away. But nevertheless, in the meantime, we're going to have to learn to live with it and evaluate and manage the risk as best we possibly can. Thank you all so much, and keep doing it, West Virginia. We're going to get through this.